Hello everyone, and today we'll complete the part 2 of central relation. Okay, let's begin. The slope of the eminence in the anterior aspect of the fossa is composed of the cortical bone. Uh, okay, that is bearing stress. So let's explain it by images. Okay, we could say here the articular eminence. The articular eminence is composed of thick cortical bone, okay, that is capable for bearing stress. Okay, the articular disc is bioconcave, devoid of nerves and blood uh, vessels in the central area, and tough, much like a piece of shoe leather. Okay, it has a few muscles fiber attached to the anterior aspect from the superior lateral retrograde muscle. Okay, so let's explain it. The articular disc, this is the articular disc, is bioconcave and is empty of nerves and blood vessels. Okay, and is very strong. Okay, okay, the disc is attached to the condyle on its medial and lateral aspects and should be interposed between the condyle and the articular eminence during function. What it means? Okay, that means the condyle and the disc and the articular eminence should be moved together during function. It's a normal position. Okay, that is the normal position. That is the condyle and articular disc and the articular eminence moved together. Okay, okay, and let's complete the condyle. The condyle is not spherical, but has a regular elliptical shape. This shape helps to distribute what stress through the TMJ rather than concentrating it in a small area. So what it means? That means we could say, hey, that means this condyle, you see it, it's not like a ball, it's spherical. It's spherical and has irregular like this, irregular like this, irregular like this, and this is help to distribute stress through the TMJ. Okay. Okay, distribute stress. Okay, many methods have been used to guide the mandible into the optimal position. Early concepts of central relation involve the most posterior condyle position in the fossa. The condyle was sometimes forcefully manipulated into the rearmost, uppermost, and midmost. That is shortcut of ram position. Okay. Okay, what this means? Okay, that means that many methods have been to guide the mandible into optimal position. Okay, earlier concepts. Okay, central relation involved the most posterior condyle position in the fossa, and the condyle in the earlier concepts said the rearmost and uppermost and midmost ram position with the glenoid fossa using a chin point guidance. Okay. However, when the condyle is rotated, it might not be seated on the central area of the articular disc. Instead, it might be on highly vascular and innervated retrodiscal tissue. The posterior attachment posterior to the disc. Figure 2.2. Let's explain it now in the image. Let's go. Figure 2.2. Okay. Okay, we see here in the number A in a dysfunctional joint with the anterior derangement, the disc is displaced anterior to the condyle at the intercuspal position. What that means? Okay, that means the disc now is anterior. Okay, and the condyle is posterior. That is not normal, because we said before the condyle is a normal position, should be correlated with the articular disc. Okay, here is not is not in natural position. Okay. Okay. In the number B, after initial rotational opening, the condyle is still posterior to the disc. That is not healthy. The condyle is still posterior and the disc is still anterior. Okay. And after that, in the maximal antercuspation, the condyle recapture the disc clicking into position as it does. So at the intercuspal, at the maximum opening, okay, at the maximum opening, the condyle is then interposed with the disc. Okay, compared to the normal, we now look at the normal. This is the normal. In healthy joint, the condyle is in a super anterior position in the fossa, with the articular disc interposed with the teeth are in maximal antercuspation. So we could say the condyle is in a super anterior, not in the posterior. The condyle is in a super anterior. This is a healthy joint. If we look at here, we could okay. If we look at here, in this infectional joint, we could see the condyle is in posterior. Okay, but in healthy joint, the condyle is supra anterior position. Okay, it's not in the posterior like this. Look at the disc. Okay. Look at the disc here. Look at the condyle. The condyle is posterior. Okay, the disc is anterior. And when we go here, the condyle is anterior. The condyle is anterior. Okay. Okay. And now we go to number B. In the initial stage of opening, not the maximum, in the initial stage of opening, the condyle rotates in the position with the disc is still interposed, is related to the condyle. Okay, with the disc remaining stationary, as I said before. Now the disc is still interposed. Okay, in the maximum opening, the condyle translates forward with the disc is still interposed. Okay, maximum opening, the condyle translates forward and the disc is still interposed. So we see that the difference between healthy joint and non-healthy joint. This is the healthy joint and this is a non-healthy joint. Okay, we could say here in the non-healthy joint is not natural, is a disease. Okay, and should be treated. Okay, and we could say the different stages. Okay, of the a different stage in the maximum anticipation and the initial opening and the maximum opening, the disc and the condyle is still interposed with together, compared to the unhealthy joint. In this infectional joint is posterior. The condyle is still posterior. Okay, and it's similar into the maximum onto the maximum opening. It's similar to the healthy joint. Okay, it's similar, but it's not very perfect. Okay, so that is make the TMG and clicking and a lot of pain, because the disc can be reduced the stress. Without disc, the condyle will be clicking, okay, and as I said before, a lot of pain, okay. Okay, that's the end of the part 2. Thank you for listening, and don't forget to subscribe our channel.